I'm a respiratory therapist, and I save lives.
A respiratory therapist is a professional who has been trained to work with patients who are affected with chronic lung disease across the spectrum.
So anything that affects your breathing, a respiratory therapist is likely going to be involved in the care of that patient.
A respiratory therapist is not only a therapist, but a practitioner. We help patients in so many different capacities, not only with breathing, but with education, with lifestyle. So we have many different roles throughout healthcare. It can involve working in a hospital such as the ICU, a neonatal ICU. We can work in the emergency department. We can work in diagnostics and therapeutics. We do outpatient education. We do smoking cessation, asthma education. We work in pediatrics. So, a respiratory therapist, we hold so many different roles that really help the community in so many different ways.
I'm a respiratory therapist.
I'm a respiratory therapist, and I care for my patients breath by breath.
The thing I like most about it is the variety of the day and the variety of the career. In the hospital I'm at, we have neonates all the way up to adults. We have a burn ICU, trauma ICU, so we can be anywhere at any time of the day.
There is always a patient that needs something unique. Sometimes there are physicians that have different needs that we have to take care of.
Obviously, it starts off finding out where I'm at, where I'm assigned to, getting a report from the night shift, seeing what the plan is for the patients, and then going to see every patient, doing rounds.
I work in pediatrics, so I may get 5 patients, may get 6 patients, but they're patients that need help with breathing. And my job is to provide them with their treatments. A typical day would be going from giving a treatment to maybe a 5 or 6-year-old that's slightly sick, then going into an intensive care unit, somebody that's much more ill, and every decision that I make on how to set that life support machine could affect their outcome.
We have so many different pieces of equipment, and they all do so many different things, from a wide variety of life support equipment to sustaining equipment to equipment that just will deliver oxygen.
So a typical day is checking equipment, getting with our people. We also will go in-house and check on the therapists in-house and see if they need anything. But primarily we're waiting for calls, and they come. We usually do 2 to 4 transports a night, and they can be anywhere from 2 or 3 hours long to 6 hours long, or sometimes even beyond the shift.
We see each patient anywhere from 1 time a day to 6 times a day, depending on the type of patient.
Day will typically end right about 5, 6 o'clock in the evening, so about 12-hour days. I'm a respiratory therapist.
I'm a respiratory therapist, and I love taking care of people.
I worked in a teaching hospital, so it was routine that we always had students, following us. Precepting students was one of our responsibilities. So that's how I got into education. I became a clinical instructor. That also opened another door for me when a program director position became available.
Empowering the patient to manage their chronic lung disease so that they understand that they can live a good life. It's about quality of life, so I feel that if I can help teach them on how to handle their chronic lung disease, it's about having the confidence that they're going to be okay.
The education and dealing with the patients, it's very satisfying to me. You go in a room with someone you haven't seen in a while, but they look at you, the family looks at you, and they remember you, and they're happy to see you, and that makes my day. It makes it all worth it. So, I'm a respiratory therapist.
I'm a respiratory therapist.
I'm a respiratory therapist, and I make a difference.
And I'm a respiratory therapist. I think that video is, of course, starting again. I have to find out where. Now it's gone. So I have been one, and everything you've seen there I've done for the last 30 years, including flying that helicopter. We pick up neonates throughout all northern Michigan. We pick them up at all our regional hospitals, and we even pick them up on Mackinac Island. And I'm open to any questions.
Dwayne, I think your video is really in depth, but I wonder what made you choose respiratory therapy as an occupation?
Well, actually, I got into it, or maybe organically, in the sense that my mother was a paramedic and became a respiratory therapist, and then she went from the hospital to home care. And as a 15-year-old, I used to help her in home care, delivering oxygen. So I was interested from there. And also, I got exposed to nursing, and I realized that did not want to do nursing. That respiratory was definitely for me. So that's what got me interested in respiratory therapy from the early age. And then it just it turned into from a job to a career. And it's just like I said, it's been 30 years, and hopefully it'll be another maybe about, I don't know, 20 years, 15, 20 years to do it. It's been an excellent career. And we have more joining us. Very nice.
How much college education does it take to become a respiratory therapist?
It's a great question. It's typically, there is an associate's degree program. It typically is 2.5 years because you have clinicals. You have to go, of course, work time in the hospital. And when I mean 2.5 years, you go through the summer. So when you start a program, you typically, you don't take a semester off. It is evolving into a bachelor's program. So a lot of the newer programs have moved it to a 4-year degree. Here at Munson Medical Center, we do work with Muskegon Community College, and you could remotely learn right here at Munson Medical Center in our program, and that is a 2.5-year degree. They also partnered with Grand Valley State University to allow you to go on and get your bachelor's, and it's called respiratory. A emphasis on respiratory applied science degree, to be official. But it's excellent. Like I said, it's an excellent opportunity if you live in northern Michigan. One of the benefits to our students maybe is they're in the hospital, so they get some unique opportunities. I think our students would tell you that if there's something good going on or some they can be part of, I'm able to involve them in that versus just being in the classroom. So I think it's a little, when they're here, it's almost technical school because they're here and it's hands-on also. So I think it's a unique, we're one of remote learning situation from a college. We're one of the few in the state that does that. So I think that's kind of exciting. So I always have students right by me. Actually,
Great.
They were just in my office before this.
If anyone has any questions, feel free to throw them in the chat. I'll be monitoring for Dwayne. But I do have another question about what can someone expect to earn as a pay range as a respiratory therapist?
So as a pay range for respiratory therapist, I'm going to pick the midpoint of around $50,000, give or take, as a new graduate. You can definitely advance from there. One thing I found in a lot of healthcare jobs, but respiratory specific, you can just about work as much as you would like. So you can make more than that from the beginning if you are ambitious and you want to work that much. So it is the job is very comparable to nursing, with wages, but there's opportunities. We do have what they call a clinical ladder. So when you go on and you add maybe credentials, you do different things above and beyond. We do have a ladder. An example, it has 5 levels, and every level is at $1. So I'm level 5. So I get an additional $5 an hour above on my wage. So it's a very nice. And again, we have this is true. I work with every respiratory department in the state. I've looked at it. We have the best clinical ladder in the state. I'm not saying I'm saying everywhere. From Detroit, it's better than Ann Arbor's. It's better than University of Michigan's. We have a very, very robust program.